My name is Renisha, and I am the healthcare facilitator for UC San Diego. And today's presentation will be on Medicare and your UC-sponsored medical plan. So today's agenda is the basics of Medicare, the requirements from UC for Medicare, your plan options, your plan premiums, how Medicare and UC-sponsored medical plans work together, and then some tools and resources will be provided at the very end. So let's talk about Medicare. So Medicare is a federal program that is funded federally, and it provides healthcare coverage for individuals who meet the following criteria. They're 65 or older and have 40 employment credits, and we'll talk about employment credits a little bit later. If you're under the age of 65 and have disabilities as determined by Social Security, you receive Social Security income for at least 24 months, or if you have end-stage renal disease. So there are several parts of Medicare. You have Medicare Part A, which is your hospital insurance, and that covers your inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. And then you have Medicare Part B, which is your medical insurance. And Part B covers certain doctor services, outpatient care, medical supplies, and preventative services. And then you have Part C, which encompasses Parts A, B, and D, and we'll talk about the Medicare Advantage plans a little bit later. And then you have Medicare Part D, which is your prescription drug coverage. And this helps cover the cost of your prescription drugs, and this includes many shots or vaccinations as well. So the premiums for 2023, most people receive Medicare Part A premium free. However, if you have less than 40 employment credits, you will have a copayment or a premium for Medicare Part A. If you have 10 years of FICA taxes where you paid into Social Security and have 40 credits, again, your premium for Part A would be $0, which most people receive premium free Part A. For 0 to 29 credits, it's $506 per month. And for 30 to 39 credits, it's $278 per month. Medicare Part B premiums are based on your income from 2 years prior. So 2023 premiums are based on 2021 income and how you filed your taxes. So for the basic bottom lower income members or employees making $97,000 or less as an individual, or $194,000 or less as a filing joint tax return, the basic premium for Part B is $164.90. And if you fall within that income bracket as well, your Part D will be premium free. But as you can see, as your income increases, so does your Part B premium. And then you may have a small Part D premium. Remember that these premiums that I'm showing you here are in addition to your medical premium that you would pay for your plan through UC. So these are separate premiums. You'll pay this premium here, wherever your income falls, in addition to the premiums we'll speak about, depending on the plan that you choose. So we often get the question, when can someone enroll in Medicare? So there are 3 basic enrollment periods. You have your initial enrollment period. This is when you first become eligible for Medicare at the age of 65. That's a 7-month period, which is 3 months prior to your 65th birthday, the 65th birthday month, and then 3 months after that birthday. And then you have the special enrollment period, which a lot of our employees fall under this because they delayed their enrollment because they were still employed after the age of 65. Now, this special enrollment period is an 8-month period of time, and it will begin the first day of the month your employee coverage ends. So as an example, if your employee if you retire July 1, your employee coverage will end on the 31st of July, and your Medicare will begin on August the 1st. Your general enrollment period is for someone who did not enroll in either the initial or the special enrollment period. And that's every year, January 1st to March 31st, and that's a 3-month period of time. And then your coverage will begin July 1st of that year. That's only if you miss your initial or your special enrollment periods. Now, who are the Medicare experts? There are 3 Medicare experts. We have Social Security, and they are the experts on enrollment, eligibility, premiums, and replacements of your ID cards. You have CMS, or the Centers of Medicare and Medicaid Services, and they're the experts on services, claims, coverage, and how to understand your explanation of benefits. And then we have HICAP, which is the Health Insurance Counseling and Advocacy Program. And they're the experts in helping you understand your Medicare and resolve any Medicare issues. So this is the Social Security website. We encourage you to create an account with Social Security, even if you're not enrolling in Medicare anytime soon. You want to create this account so you can go in and see how many credits you have, employment credits you have, just in case you don't think that you'll be eligible for Medicare. So you can kind of monitor those numbers. So this is the main Social Security page. You can create an account on the main Social Security page, and you can also apply for benefits and sign up for Medicare from the same page. So now you don't have to go searching for how do I apply. There's a quick, simple click, apply for benefits or sign up for Medicare tab right on the main Social Security page for your convenience. So what are UC's Medicare requirements? Everything you need to know about the UC's requirements that come with Medicare can be found on the Medicare fact sheet. This should be like your Bible of Medicare for UC plans and what UC will require of you. You can download this via UCNet, and in the slide deck, the link to UCNet and the Medicare fact sheet is listed on that reference page. So if you're still working, we talked about this, and you're aging into 65, some people delay enrollment in both Parts A and Part B. However, there are some people who enroll in Part A because it is premium free, but they delay Part B because there will be a premium that you'll be paying, and then you're not even going to be able to use Medicare Part B because your UC plan, if you're still working, your UC active employee plan will be your primary. So Medicare will not even receive any of your claims anyway. So if you're eligible for Medicare while you're still working and don't plan to retire, again, Part A is optional and you can delay Part B. If you plan on continuing to work past 65, you will remain covered on a UC medical plan. That's the active medical plans. However, for Kaiser members, you can do the same and delay your Medicare enrollment, but if you're enrolled in Kaiser and you have a lot of out-of-pocket expenses, enrolling in Medicare Part A and Part B may benefit you. So if you're consistently spending more than what it would cost for your Medicare Part B premiums every month in copayments, it may benefit you to enroll and pay for Medicare Part B. By doing this for the Kaiser plan only, Kaiser will waive all your copayments. And this is the only plan, again, that will do this while you're still employed. So if you're in any of these other plans, UC Blue and Gold, UC Care Core, you can enroll in Part A, but delay enrollment in Part B. Kaiser, depending on your out-of-pocket expenses. And then the health savings plan. If you have any parts, Medicare A or B, you cannot be enrolled in the health savings plan. So if you're still employed and you're past the age of 65, aging into 65, don't even take Part A if you're enrolled in the health savings plan. Delay enrollment in both A and B because you cannot have any parts and still be on this plan. If you're planning to retire and you're over 65, you or your dependents are over 65, this is considered, as I spoke about earlier, your special enrollment period. And CMS will require the request for employment information, or the CMS L564 form. This should be completed by your employer. This form provides proof that you were covered under an employer plan, so you're not assessed any late enrollment penalties by Social Security and Medicare. You can contact my office at the HCF Help email and request that a CMS form be completed for yourself or a dependent that needs the form completed because they were covered under your employer plan past the age of 65. And I will complete those forms and return them back to you. And then those are submitted to CMS. Okay, so Medicare enrollment is required for all retirees over the age of 65. If you're eligible for premium-free Part A, you must enroll in Medicare Part B. Ensuring a retiree costs twice as much or more than an active employee, so enrolling in Medicare allows UC to offset the cost of insurance and pass those savings down to the retiree. In order to enroll in the UC-sponsored Medicare plan, you must enroll in both Part A and Part B, and your Medicare card must reflect both with effective dates. Failure to comply with this requirement will result in penalties and permanent loss of UC-sponsored medical coverage. There are two exceptions, and that is those that worked for UC prior to July 1st, 1991 and did not pay into Social Security, so they don't qualify. And then those retirees who reside outside of the United States, because Medicare is not required outside of the United States. However, if you move back into the United States, UC will require you to re-enroll in Medicare. And there may be a Medicare late enrollment penalty assessed by Social Security. So Medicare Part D, most plans with Medicare prescription drug coverage have a coverage gap called a donut hole. This means that after you and your drug plan have spent a certain amount of money for covered drugs, you have to pay all costs out of pocket for your prescription drugs up to a yearly amount. UC plans, no UC plans have donut holes. So you just need to make sure you complete the form when you're the UBIN forms require when you're first enrolling, so that Medicare knows that your UC plan includes Part D. More information about Part D: no duplicate Part D coverage is allowed. Enrollment in an outside non-UC Part D plan may result in a loss of coverage, because if Medicare reports that you have two Part D plans, UC's plan will drop and you'll be on the other plan, and you can't have Part D on our UC plans and then a Part D somewhere else. So I can explain more about that a little bit later. The only exception to this would be if you enrolled in the UC Medicare PPO plan that does not have prescription drug coverage. Okay, so if you're eligible for Medicare when you retire, each family member must complete the Medicare prescription drug form according to the plan you're currently enrolled in. So for those enrolled in UC Blue and Gold, you would complete the UBIN 121 and enroll in UC Medicare Choice PPO. For Kaiser non-Medicare, you would complete the UBIN 127 and enroll in Kaiser Senior Advantage. For Core and Care, you will complete the UBIN 123 and enroll in UC Medicare PPO. And then again, we talked about the UC Health Savings Plan. You cannot be enrolled in Medicare and have that plan, so you must choose from one of the plans above. And as I stated, each eligible Medicare family member must complete their own form and attach a copy of their own Medicare card when submitting to the RAS. So what if you're not eligible for Medicare under your own employment record? If you were married, you may qualify under your current spouse's work record when they reach the age of 62. If you're single but was previously married at least 10 years, you may qualify under your former spouse if they were eligible for Social Security benefits when they reach the age of 62. You can find out if you're eligible for under any of these other spouses through Social Security. And it's important that you know your Medicare status, because UC will not know unless you tell us that you're eligible and enrolled in Medicare. And it's important for you to look at that fact sheet that I spoke about earlier so that you know what's required and you're not penalized at a later date. So let's talk about the retirement, a retired employee Medicare eligible enrollment timeline. So if you age into Medicare after you retire, this is after you retire, UC will send you instructions called an aging in packet 3 months prior to your 65th birthday. So in this example, this retiree is turning 65 in the month of April. UC will send a notice to enroll, so the aging in packet will come in January. Then you have 3 months, January, February, and March, to complete your forms and submit them to the RAS. If you do not respond by the month of May, there will be penalties from your pension check for 3 months in the amount of $419.60. They did put a memoriam on this amount during the pandemic, but I believe starting April 1st, it has been reinstated. If you're not eligible for Medicare, once you try to apply and they deny you Medicare eligibility, you must request a denial letter and submit that to the RASP. And then once you submit that to the RASP, you will remain in a non-Medicare plan. So how are Medicare premiums paid? If you are currently collecting Social Security income, your premiums will be taken automatically out of your Social Security check. They'll automatically send you a Medicare card 90 days before your 65th birthday. If you're not collecting Social Security, you go and you apply to Medicare 3 months before your 65th birthday, either in person or online using that website that I showed you earlier, or you can call them and complete it over the phone. In order to pay your Medicare premiums and you're not collecting Social Security, you'll set up those payment arrangements with Social Security. And again, if you're not eligible, request that denial letter and send it to the RAS. So plan options for Medicare depend on where you live. In California, you have 3 PPO plans: the Medicare PPO with and without prescription drugs, and the high option PPO. Everyone in your family must be enrolled in Medicare, and it's only available during open enrollment. Then you have 2 Advantage plans. You have Kaiser Permanente, Kaiser Senior Advantage, and then you have the UC Medicare Choice PPO plan administered by United Healthcare. If you live in a state outside of California, you have Anthem Blue Cross, the 2 PPOs, Medicare with and without prescription drugs. And then if everyone in your family is in Medicare and you live outside of California, you will select an individual plan via benefits. You can stay enrolled in Delta Dental, VSP, and ARAG, and you must complete your UBEN 100 form in order to make any changes to dental, vision, or legal services. If you live abroad, you do not have Medicare coverage abroad, so we encourage you to enroll in either UC Care or CORE. Another question we often receive is, if I'm eligible for Medicare or someone in my family is not, or vice versa, what is going to happen to someone's coverage if I'm Medicare eligible and they're not? So your non-Medicare eligible family members will stay in the non-Medicare plans, and then the Medicare eligible family members will go into the Medicare plans. So UC Blue and Gold and UC Medicare Choice are the partner plans. Kaiser Permanente and Kaiser Senior Advantage, Core, UC Care, and the UC Medicare PPO plans. And then the Health Savings Plan, you have to choose one of the other plans. No one in your family can have any parts of Medicare for the Health Savings Plan. And also wanted to reiterate, whatever the retiree plan is what drives those dependents. So for instance, if the retiree is on UC Medicare PPO, the non-Medicare member would have to be either Core or UC Care. They cannot be on, say, for instance, Kaiser or UC Blue and Gold. UC's Medicare plan premiums. So retiree, an active employee, your premiums are based on incomes and they have the income brackets. Well, once you retire, your premiums are based on your retirement tier, your years of UCRP service credit, the level of coverage you have, the plan that you choose, and whether or not you're eligible for Medicare. So the years of service is based on whole years. For example, if you have 16.9 years of service credit, your premium will be based on 16 years of service credit. So the RAS rounds down and not up when it comes to your service credit years. So here's an example of a retiree covering a spouse or a child, and everyone is in Medicare and enrolling in UC Medicare PPO plan. Your premium would be $233.26 per month, and that will be deducted from your pension check. As you see here, there is no Part B premium reimbursement for this particular plan. However, you can see both Kaiser and UC Medicare Choice have a Medicare Part B reimbursement. So let's quickly discuss the Part B reimbursement. If you're eligible for one of UC's Medicare coordinated medical plans, it's possible that you'll get a portion of your Part B premium refunded to you. That's because the amount UC contributes towards your retiree medical benefit is sometimes higher than the total cost of the premium. If this is the case, the university will refund part of the amount that you paid for your Medicare Part B premiums. This reimbursement is added to your monthly pension payment or each month. Please note that the premiums that you're seeing here are based on 100% UC contribution. So that being said, here's a side-by-side of somebody that has 100% UC contribution and someone who has 50% UC contribution. So the total monthly premium for UC Medicare PPO, so MM, everyone in this household is on Medicare. The total monthly premium is $899.70. The max that UC is going to pay on that premium is $666.44. Since this member is getting 100%, they're going to take that whole contribution. And that's what UC is going to pay of this $899, which leaves the retiree to pay $233.26 for them and their spouse or their dependent, both on Medicare. This is what's coming out of your pension check. Somebody with 50% UC contribution, they're only going to pay half of this max contribution. So they're only going to pay $333.22 of that $899, which leaves the retiree to pay out of their pension check $566.48. So here is the breakdown. So this is what would be coming out of your pension check. So from the $899.70, 100% UC contribution, total retiree pays. And then if you have two people in Medicare Part B, this is what you're going to be paying to Social Security. So $164.90 for two people. Your total premium, UC's plan premium plus the Medicare Part B premium is going to be $563.06. What you're going to see coming out of your pension check is $233.26, and you'll be paying this 164 times 2 straight to Social Security or Medicare. So as I stated, your UC premiums are deducted from your UC pension. Your Medicare premiums are either paid out of your Social Security through Medicare Easy Pay, which is an online pay system, or through quarterly billing. They will send you a bill in the mail every quarter, and then you would pay accordingly. And then your Medicare Part B reimbursement is a credit on your UC pension check, and it's available to those with the least expensive plans, and majority of them are 100% UC contribution. So let's get into your Medicare Advantage plans. So UC has two Medicare Advantage plans. So we have Kaiser Senior Advantage and the UC Medicare Choice PPO plan. So basically, if you have Medicare Part A and B and you're enrolled in one of these Advantage plans, you're assigning your Medicare benefits to your plan. So when you go see the doctor, you're only taking the Advantage Care Plan card, not your Medicare card. Medicare is going to be secondary while your plan will be primary. And Medicare cannot be used separately from your Medicare Advantage plan. So these two plans, if you're currently on Kaiser or UC Blue and Gold, you would go into one of the Advantage plans, Kaiser Senior Advantage or UC Medicare PPO. So this is a side-by-side comparison of if you're currently enrolled in Kaiser and if you were to go into Kaiser Senior Advantage. Mostly everything stays the same. Your Kaiser Senior Advantage has a little bit more plan enhancements. Your emergency room services will go down to $65, but it is going to be waived if admitted, just as it is with your Kaiser Permanente. All your wellness apps remain the same. Your prescription drug coverage remains the same. You do inherit eyeglass coverage once you receive Kaiser Senior Advantage. It's $152 every 24 months for lenses, contacts, and frames. For behavior health, when you're on regular Kaiser non-Medicare, you do have Optum as a provider option. However, for Kaiser Senior Advantage, you do not have Optum. It's only Kaiser providers. For hearing aids, your allowance goes up to $2,500 on Kaiser Senior Advantage per ear every 36 months. For acupuncture and chiropractor services, while on Kaiser non-Medicare, it's a combined service. It is separate on Kaiser Senior Advantage. And this is when it's covered medically necessary or covered by Medicare. And then your out-of-pocket maximum for an individual is actually per member now on Kaiser Senior Advantage. So it's $1,500 per member for medical and $6,550 prescription drugs per member. You still have access to the Minute clinics with Target, and we have those extended Fallbrook and Kern County zip codes. The side-by-side for UC Blue and Gold and UC Medicare Choice, everything pretty much remains the same, but there are some enhancements for UC Medicare Choice. Your emergency room services go down to $65, but it is waived if admitted. Prescription drugs, outpatient surgery, and inpatient mental health inpatient services all remain the same. Your office visit copayments and behavioral health copayments remain the same. For your hearing aid allowance, it's $2,000 every 3 years with no quantity limit for UC Medicare Choice when there is a limit over on UC Blue and Gold. You have separate benefits for acupuncture and chiropractic care. Telehealth services, you do have additions under UC Medicare Choice of Amware Doctor on Demand and Teledoc. You have additional services on UC Medicare Choice, which is the post-hospital discharge meals. There's 28 of those. And you also receive 12 one-way trips to doctor's visits after you're released from the hospital. And then you have the Life Alert emergency response system by Lifeline that you can receive as a member of UC Medicare Choice. And then for your physicians and medical groups, UC Medicare Choice, instead of being stuck in a group, you have open access. So you can receive your Medicare medical of choice, whether in or out of network. It plays the same as long as they accept the plan, have not opted out of Medicare. Your annual out-of-pocket maximum is per member for UC Medicare Choice. So it's $1,500 per member and $2,000 prescription per member. And then you have all of the CVS's and worldwide coverage and urgent care and emergency services for both plans. So Medicare and the PPO plans. So Medicare supplement plans, if you're in UC Care or Core, you will go into a PPO plan. Now with the PPO plans, they are supplement plans. So your Medicare for this plan is primary and your Anthem Blue Cross is secondary. So you would need to maintain or retain both your Medicare card and your Anthem card when receiving services. So Medicare would pay first, and whatever Medicare doesn't pay, Anthem Blue Cross would pay. You must use Medicare certified providers, and you should ask any current or future providers if they are accepting new Medicare patients. For the UC Medicare PPO plan, it is a $100 deductible. Your inpatient services, you do not pay until your 91st day, or 61st day, I'm sorry, and your 61st day is $70.40, and then you go into the 80/20 after your 90th day. For your physician's visits, it's 20% or 20% plus any remaining balance. Prescription drug coverage, your generics are $10 for a 30-day supply and $20 for a 90-day supply. And then it goes $30.60 for preferred, $45.90 non-preferred. And then for specialty drugs, it's $30 and $60. There is no eyeglass coverage. So we encourage you to consider staying enrolled or enrolling in VSP. There are hearing aids and acupuncture services are not covered by Medicare. So you'll go by the 80/20 rule. So Anthem will pay 80%, you will pay 20%. Annual out-of-pocket maximum for UC Medicare PPO is $1,500 for medical and $7,400 for prescription drugs. You do have telehealth services 24/7 at a $20 copay. And as with all the PPO plans, it's worldwide coverage up to 6 months. If you plan on staying outside of or moving outside of the United States for more than 6 months, you must enroll in UC Care or Core. High option, this plan is only available during open enrollment when everybody in your family is enrolled in Medicare Part A and Part B. It's a $50 deductible, and after this $50 deductible is met, most services are paid at 100%. The 80/20 rule for inpatient services after the 91st day. There's no co-payment for physicians or chiropractic visits. Behavior and mental health services, if provided by Medicare, you pay nothing. Otherwise, there's an 80/20 rule for non-Medicare services. Prescription drugs, generics are $10, 30-day supply and $20 for a 90-day supply. Preferred brands, 30 and 60, and these include diabetic supplies and syringes, swabs and gauze. Specialty drugs, $30 and $60. No eyeglass coverage with this plan as well. You should consider staying enrolled or enrolling in VSP. Hearing aid and acupuncture services are not covered by Medicare, so the 80-20 rule applies here. Annual out-of-pocket maximum is $1,050 medical, $1,000 for prescriptions. And then telehealth services are available 24/7 at a $20 copayment. As with the other PPO plan, as I discussed, worldwide coverage up to 6 months. If you're going to stay outside of the US for over 6 months, UC Care or Core are your options. The health savings plan. As we stated, the health savings plan is not compatible with any parts of Medicare. If anyone in your family becomes eligible for Medicare, you must contact the RASC or your local benefits office and enroll in a different UC-sponsored plan. You must stop contributing to the health savings plan the month Medicare coverage begins. The funds in your account will not be lost and can continue to be used for eligible expenses. A distribution can be taken at the age of 65 and will be taxed as normal income. It's your responsibility to ensure that you meet the health savings plan eligibility requirements, as UC will not know about your Medicare enrollment until you inform us. So your behavioral health plan administrator is dependent on the plans you are enrolled in. These plans provide counseling and resources for issues such as anxiety, stress, work issues, substance abuse, and more. So if you're in UC Blue and Gold, your behavioral health plan is Managed Health Network or MHN. Kaiser is Kaiser and Optum. Kaiser Senior Advantage is only Kaiser. For the PPO plans, it is Anthem Blue Cross. And for UC Medicare Choice, it's United Healthcare. But we also wanted to let you know that even when you retire, employees, retirees, and their family members can still access the Family Staff Assistance Program, or FSAP. They offer free confidential counseling, assessments and referrals, educational workshops, and support groups. You can call them at the number listed here or log into Blink and search for FSAP for assistance. VIA benefits for retirees living outside the state of California. If you reside outside the state of California and all family members are enrolled in Medicare, your benefits will be administered through VIA Benefits. VIA Benefits is UC's Medicare Coordinator Program for retirees living outside of California. This program offers choice, value, flexibility, and support with more local plans to fit every budget that allows family members to elect different plans and receive personalized assistance. UC will provide an annual contribution for each covered family member under a health reimbursement account based on graduated eligibility. This amount ranges from $1,500 to $3,000. You may use these funds to pay for your medical premiums, prescription drug premiums, or even Medicare premiums, along with other eligible expenses. You will be contacted by VIA Benefits when you become eligible. If you need to make additional changes to your dental, vision, or legal plan coverage, if you're enrolled in VIA Benefits, you must complete the UBIN 100 form to make any changes to those other plans. So things to consider when choosing a Medicare plan. Every plan has a different drug formulary. So look at your plan's evidence of coverage, prescription drug coverage booklet, and see if your where your medication falls under the drug formulary. Match your priorities with the services available. Do a cost or benefit analysis based on plan premiums and your expected medical, behavior, and pharmacy needs. Review the plan booklets. Your evidence of coverage booklets can be found on UCNet. Or go on to the the ACF program site and read the fine print. We always say read the fine print. So we often also get the question, can I change my medical plan when I retire? Retirement is not a qualifying event to change your plans. Qualifying events such as moving outside of your plan service area, newly eligible dependent, so you had a child, you adopted a child, you got married, or divorced, or you started a new domestic partnership. You have involuntary loss of coverage through another group or another employer. You're under your husband's employer. Enrolled in UC's health savings plan and aging into Medicare. These are the qualifying events that you can enroll in another plan outside of open enrollment. Open enrollment is your opportunity to change your plans. So I know I covered a lot of information, but I also wanted to give you some helpful tools and resources that you can use during your journey through Medicare. So UCNet has all your information on your evidence of coverage booklets, your Medicare fact sheets, your retirement handbooks, and things to do when you leave UC employment. Then it also has the retiree medical cost plan costs. We have quick reference guides, which Medicare plan and which medical plan is right for you. You can see retiree health eligibility rules. CMS's information is here. Social Security's information is here. HICAP information is here. And then the RASC, the Retirement Administration Service Center. Their information is here. You have the Retirement Association. Membership fees are listed here and they're linked. They have a lot of helpful resources and useful information. And I encourage you to become a member. And then via benefits link. So the retirees that are living outside the state of California can get more information on via benefits. The health benefits office information, campus benefits office information, and our senior benefits analyst names. And then my information, I'm the healthcare facilitator. Again, my name is Ranisha. I can be reached at this phone number here. And my general email is hcfhelp@ucsd.edu. I am going to open up the floor for questions. I do see some questions in the chat. I'm not sure if anyone was able to answer them. Let me go really quickly. There is only one HMO option for retirees and it's Kaiser. Do I see that correctly? Yes, there is only one HMO option and that's Kaiser. UC Medicare Choice is a PPO plan, but it kind of operates like an HMO plan. So there's no, but it's kind of both because it's an advantage plan. But as far as a straight shooter HMO plan, yes, Kaiser is the only straight shooter HMO plan. Yes, you can get copies of the slides. Send me an email to, I'm going to put my email in the chat. Send an email requesting the slides and I will get you a copy of the slides. So that's 1, 2, 3, 4 questions. Troop, give me 1 second. I will explain Troop to you. Okay, copy of the slides. Dental coverage with UC does not change once you go into Medicare. So if you're enrolled in Delta Dental or the Delta HMO, that coverage does not change because you have enrolled in Medicare. After I apply for retirement and fill out CMS, can I send that in the same day to apply for Medicare with? Okay, so CMS forms are submitted to with your Medicare application. It does not come to us for any reason. The CMS L564 or the 408 does not come to us. We just complete the CMS L56 form for you, but we don't need them for any other reason. Those go to your Medicare application. Also on form, they want to begin date of my medical insurance. Is that date 1/1/23 and in? Okay, I'm confused. I don't understand what you're saying, Patricia, your second part of your question. Do you want to unmute yourself and ask it aloud?
Yeah, I thought on one of the forms, they were asking for Medicare, they wanted to know the begin date of your group coverage and the end date. And I thought, well, the end date's going to be 7/31, but as far as the begin date, I'm not sure what they were asking for with that.
So for your, it most likely when you first were enrolled, so the beginning of your enrollment in UC coverage, so they want to know your group coverage, so if you are retiring 7/1, your end date will be 7/31, your begin date will be whenever you started working for UC and enrolled in the UC medical plan.
Okay, so okay, got it. Thank you.
You're welcome. And as far as when do you get your CMS form, sometimes they don't ask for it, so you should start your Medicare process, go online and start going through the process. If they ask for it, request it. If they don't, you don't have to worry about it.
Okay,
So
so when I fill that out on Saturday, that should be kind of all done. I don't have to send it in to you guys to do something and you send it back.
for the CMS L564 form,
Yeah.
it has to be completed by somebody at UC. So
Okay, so I do have to
myself
wait.
or
Okay.
or the rest.
Okay,
But that's only if they ask for it. They might not, like I said, they might not ask for it. Sometimes they do, sometimes they don't. Depends on how far out of 65 you are,
okay,
usually.
okay, thank you.
Currently, UCSD and Aetna are negotiating contracts. If that contract negotiation fails and Aetna for qualifying event, yes, it would be a qualifying event if your spouse's employer. No, does loss of Aetna mean the loss of his insurance coverage, period, or is Aetna his only option?
He has Aetna, and the options would be to switch to a different healthcare system because UCSD would not accept Aetna at that point if the contract negotiations fail. So in order to continue our care at UCSD, could that be considered, the failure of the contract negotiations, a qualifying event to go on a retiree health plan at that point?
No, because he's not technically losing his coverage. He's losing that option.
He's losing the contract part of the option, yes.
Yeah, so he's just losing that option, but there's other options he could go on. So I don't believe that's considered a qualifying event, but I can check. I'll double check on that.
Okay, thank you.
Give me 1 second. I'm trying to comb through these.
I don't believe you answered the troop question.
I didn't. I'm gonna do that last because there's a couple people that have the same question. So I'm trying to get the ones that are super fast out real quick. Tammy, send me an email. I'm not gonna be able to save this to get yours. I noticed there's a $7,500 deductible for drugs on UC Care. How does Part D fit in? What do you mean? How does Part D? Can you clarify your question, Karen?
Well, I don't understand why there's a deductible if I have Part D. I mean, I guess I don't understand how that works together.
So you have Part D. Part D is just the actual is the actual part of Medicare. So that has nothing to do with your Part D plan. Your Part D plan is encompassed into your UC Medicare PPO plan. or UC Care plan. You said UC Care, but UC Care is not a Medicare plan. It's
Oh, I
UC
meant, yeah,
Medicare PPO.
yeah, the PPO. I
Um,
guess what I'm asking is if I have UC Care right now, and then if I
Yeah.
go into the Medicare PPO plan, which is the same plan, I think,
mhm.
and I go for are my drugs going to be covered, or do I have to spend $7,500? I don't understand.
Your drugs are covered, but your 7,500 is your out-of-pocket maximum. So that's the most that you'll pay in co-payments under that
For
pay.
co-payments, okay.
Correct. So
Yeah.
once you reach that $7,500, that's when they won't make you pay any more co-payments.
Okay, but it's just for the co-payment portion.
Right, of your prescription
Right.
drugs.
Okay, thank you.
You're welcome. The difference between UC Care, PPO, and high option. UC Care is not a Medicare plan, so I'm assuming you're UC Medicare PPO and the high option. There's several differences. I can give you a link to the comparison page, and you'll be able to see side by side. Here's the PDF. Oops. There's a comparison link. Came out of retirement, now working in Bermuda. Medical insurance is mandatory at my job, so I am paying double premiums. Can I put my UC and Medicare plans on hold and only use my current employer's medical plan? Yes, so you would complete the UBIN 100 and suspend coverage. And then once you, I'll put a link for the UBIN 100, once you receive, once you don't have that coverage or you come back to the US and you want to get back on UC, you'll complete the same form to re-enroll. But I will put that in the chat. Okay, so let's see. Sorry. Okay, I see people still asking for the slides in the chat. Remember to send me an email, hcfhelp@ucsd.edu. Okay, so the difference between the UC Advantage plans and supplement plans is with the Advantage plans, you're basically giving up, in a sense, your original Medicare. So the plan is primary and Medicare is secondary. With the supplemental plans, Medicare is primary and the supplemental plan is secondary. Do we need a supplemental care plan with Kaiser? No. Coverage for durable medical equipment for sleep apnea. Are you asking which plan covers CPAP machines? Elsie? I'll go back to that. Yes, John, your spouse would need to begin her Medicare coverage on 8/1, and she should have started applying 3 months before you retire, just as you would if you was you that were going into Medicare. Am I correct that if I have UC Care, PPO, I will continue to pay premium and begin Medicare Part A premium essentially? Medicare requires an additional cost to. So as I stated earlier, your Medicare premiums and your plan premiums are separate. So yes, it's an additional cost. I would be filling out 127, but I got a letter from Medicare saying it's time to choose which way I get my coverage. Yeah, you don't have to worry about that. The 127 form is what notifies Medicare that you have coverage. So you don't need to notify them directly. You just need to apply and enroll via UC. Retired 3/1, my spouse, and adult coverage ends 3/31. The HSA, you could still have your HSA, but you can't contribute. I'm gonna have to take that question. Rosegate, can you send me an email? I'm gonna have to take that question offline.
Yes, I'll do that. Thank you.
Lay, no pre-existing affects anything. You don't have to worry about pre-existing conditions. You guys are welcome about the presentation. Still confused where we should get our Part D coverage. UC has Part D coverage encompassed in all of our Medicare plans. You still have to enroll in Part A and B. You don't have to enroll in Part D. The UBIN forms that I spoke of is your prescription drug coverage form. So that is attaching your prescription drug coverage to the plan. Hopefully that made more sense. Can you switch from UC Medicare PPO to UC Choice to, yes, during open enrollment, yes, you can. And then your coverage will be effective January 1st of next year. You're welcome, Paul. You're welcome, Versalin, and Ron, I see your hand. I'm sorry. And then I'm going to get to that troop question. I'm sorry, you guys.
Yeah, I wondered if you could talk about formularies, and it seems within the last year or two, the formularies, some of my drugs, I wonder if other people have experienced this. Some of the drug costs have dramatically increased for the co-pays. And I don't know if you have any, is that something you could follow up with us if we have a specific question about dramatic increases in drugs for our particular plan? Because I think, correct me if I'm wrong, my understanding is each plan has its own formulary, which if people aren't aware, that's a list of drugs and co-pays. So do you have any comments generally about formularies? And
are we talking about Navitus?
Yeah.
Yeah. They are, they're the only ones that have gone up dramatically or drastically. So I knew that's who you're talking about. I honestly can't tell you why. They just changed up, I guess, where certain medications fell and what tier they fell in, and then that made, co-payments and everything kind of shoot up.
Are they reassessing their relationship with the Navitus? Or
I believe they had a 3-year contract, and that's coming up for renewal this plan year.
Okay. Is that only related to the Medicare supplement?
Oh, no, Navitus is for all of our PPO plans. So it's not just our Medicare
everything.
plans, it's for all of our PPO. So any plan that has Anthem has Navitus.
Okay.
So
well, hopefully they can fix that. Yeah. I'm sure you've gotten a lot of complaints.
Oh yeah, we've compiled a database across UC about all the complaints. It's really tapered off. I think people just have come to terms with, like, I'm just gonna have to pay it anyway, so they stopped complaining. But we have a lot of stuff to tell UCOP once it comes up for bid again, for sure.
And then in general, anytime we have an issue, we can your office would be the one to contact if we have,
yes.
For example, if our plan refuses doctors' request, a primary care doctor's request for coverage, and we want to appeal that, that would be something you could help us potentially with dealing with.
Yes, I can.
Okay, thank you.
And thank goodness I'm getting a assistant, so I'll have somebody helping me out soon, so
Okay, thanks.
you're welcome. Fill out the form to indicate. Or do we need to do anything for me? Yes, the UBIN forms, Elizabeth, that we spoke of earlier, depending on the plan that you're gonna be enrolling in. Do you know which plan you're gonna be enrolling in? I can let you know which UBIN form you're gonna need to complete to assign your prescription drug coverage. Are you still on? Oh, so you see Medicare PPO, so you'll be doing the UBIN 123. Please
Great, thank
clarify.
you.
You're
Yeah.
welcome. Please clarify, I have Medicare and United Healthcare, which plays first? United Healthcare will pay first, and then Medicare will be your secondary, because remember we said choice is it's an advantage plan. Yes, but most doctors do accept Medicare, but you do need to ask them if they're taking new Medicare patients. So if you're seeing somebody that you haven't seen before, make sure they're accepting new Medicare patients. If you have your regular doctor and they're taking Medicare patients, you can just stay with the same doctor that you have. So you see Medicare Choice, do we get 2 cards? No, you only have 1 card. You'll have Medicare Choice card, but then you will get a Medicare card with both A and B on it. But from United Healthcare, it's only 1 card. Question 3 on the UBIN 127 just says, do you or your spouse work? My husband works, but he's not on my medical plan. Let me look at the UBIN 127 real quick. And I can tell you. Question 3. So you answer yes if the person enrolling or the UC retiree is employed and eligible for any health insurance benefits elsewhere as an employee. So you're going to say yes, he does work, right? So yes, I would say yes. Because he works and he's eligible, but wait. Yeah, because he's working and he's eligible for health insurance benefits somewhere else, but he is taking it somewhere else, right? Stacy? I'm confusing myself a little bit. Still on? No, okay. United Healthcare, you don't have to pre-authorizations for anything, no. You have the HMO, the PPO luxury. So there is no pre-authorizations. You can self-refer. You need supplemental insurance for what? I need to get into this true question too. Allison, can you explain what do you mean by do we need pre-authorizations or supplemental insurance for what? Okay, while we wait on that. So Troop. So Troop is the true out-of-pocket maximum. So they're the payments that count towards your medical drug plan for your out-of-pocket threshold. And that determines when the catastrophic coverage will pick up. So this is your absolute true out-of-pocket maximum before catastrophic coverage begins.
And what is catastrophic coverage?
So that's like if you had absolutely no coverage, the state will basically be paying for everything. It's like extra help. Medicare's extra help will pick up, charities will start paying, things like that. Nobody ever makes it to that Troop though, that I know has ever made it.
So a lot of times they recommend supplemental insurance. Do you recommend that through UC plans?
No, because like I said, I've never seen anybody reach their troop. They might
Oh.
reach their out of pocket max, but they've never reached their troop ever.
Okay,
Even when Deborah was here, she told me nobody's ever reached their troop. So,
okay, thank you.
a link to the UBIN forms. Yeah, give me 1 second. So it's just it's on UC Net. You can search forms and all of the UBINs will come up. Anything that you would ever need a UBIN form. The UBIN forms go to the RASC. They go to the RASC and their contact information is on the top right-hand corner of all the forms. I suggest either uploading it to your UC Raise account or sending it via fax. If you mail it, snail mail could take forever and a day. So I would suggest faxing or upload. I currently have Kaiser and plan to spend more time in Puerto Rico. Is there any different? No, that you'll go into Kaiser Senior Advantage, but like with all HMO plans, if you go outside of, so Kaiser's California, right? So if you go outside somewhere, but you have urgent or emergent care visits, Kaiser's going to cover it. So as long as it's not like a regular doctor's visit, you can be in Puerto Rico if you have urgent or emergent care services needed, go see the doctor and Kaiser will cover it. But like I said, you'll be under Kaiser Senior Advantage, so there's nothing you can do. Yeah, for regular doctors, you cannot go to Kaiser to see a regular physician's visit, physical, or what have you, if you're in Puerto Rico. So if you plan on moving to Puerto Rico and having that your permanent address, I would suggest you enroll in UC Care. UC Care or CORE, or it's still US territory, right? So you can do UC Medicare PPO plan as well. All right, those are all the questions out of the chat. It is, I think it was supposed to be over at 11. You can send your, is it 11 or 11:30?
11:30, but
Oh,
if
okay.
no
So if
one
there's-
else
yeah.
has any questions.
You
we
can go,
end early.
I'll hang out for a few more minutes with any questions you may have. I'll send out those slides. I did get a few emails already, but I know Yumi said she was going to, also I'll send it to you guys as well, so you guys can upload it and send it out to all the participants. But that's it for me. Thank you for joining me today. I hope you got everything you needed. Can you unmute? I don't know where you are. Let me see. Okay, I sent you a push to ask you to unmute. It does, I don't know. It says you're unmuted. Can you hear? Try to connect to computer audio. See if that works. There you go, Elizabeth. I just typed it in the chat. You're welcome, everyone. Thank you so much for joining.
Thank you, Ronisha.
You're welcome.
Renisha, are you going to stay behind for a quick question?
Absolutely.
Okay. Is anybody else waiting to ask you a question? I can wait for my turn.
Not that I can see. Warren, what questions did you need a meeting for about retirement? Because I'm not a retirement counselor, so I wouldn't be able to assist you in that matter.
Well, the question I have, I'm permanent part-time, so if I retire before my spouse who also works at UC, like, I'm trying to get clarification, like what coverage would I need? Because I'm not.
Are you just gonna, are you gonna retire or leave and enroll it under her plan?
Yes, I'm gonna switch to her plan before I retire. Because I'm not in the pension plan,
Mm-hmm,
so I wouldn't make that 20 years or 10 years.
right, right. So you would be losing coverage once you leave or once you retire. So you can go, yeah, you can enroll that. You've been 100 form, you can enroll under her plan before you retire.
Okay. Thank you.
You're welcome.
My question is a little similar to
Mhm.
his.
Okay,
It's the other way around. So, I have about 32 years of service. And
okay,
I'm planning on retiring, July 1.
okay,
My husband is also employed, but he has less years in service. And we're both signed up under my plan, UCSD Healthcare, Kaiser.
okay.
So I've been sending the questions to our benefit office, but I haven't heard anything back from them. My question was, if I temporarily suspend my plan, my my retiree health plan,
Mhm,
and I sign up under his, because he's going to continue to be employed. He's not going to retire anytime soon.
right,
So my plan was to enroll under his. He's going to have to do the same thing because he's currently under me. So it's my understanding that he needs to enroll then, once I retire under his own plan. Can I switch over to his plan like temporarily? And then once he retires, can we both switch under my plan? Because I have more years of service than he does.
yeah, so you're gonna first, so what you're gonna do is you're going to suspend your services and enroll under him.
Okay,
And then, once he retires, then you guys will be able to during, see that it's gonna, you guys are gonna have to stay under him until open enrollment the year he retires, and then you can switch to you.
okay, so open enrollment, okay.
Yes.
Okay, so for him right now, when does he have to enroll under his own plan? If I'm retiring July 1.
Not gonna be able to until open enrollment.
Okay, so he stays under my plan
Mhm.
until open enrollment, like
Yes.
until November.
Right. And then
Okay.
open enrollment, you can switch both of you guys on over to whichever plan you wanted to switch to, the active plan. That will be effective January 1.
January 1. Okay.
Yes.
Okay. So I saw the premiums for Kaiser. So he's 65, right?
Mhm.
He hasn't
Yes.
applied for Medicare A and B. He hasn't done that yet.
Right. He doesn't need to until he's getting ready to retire.
Right. So for the premiums that I would have to pay, it's my understanding that it's like a split premium with Kaiser.
No, it won't be a split premium because since once you get enrolled under his plan, you don't need to be enrolled in Medicare either. You guys will both stay under the regular Kaiser plan
Okay.
as an employee. So it'll be under his employee wage, how much you guys pay for premiums. It wouldn't be under the retirement premium.
Oh, but I thought you just said that he can't enroll himself under his own plan until November, under open enrollment.
Right, that's what I'm talking, you're talking about before open enrollment,
Yeah, so what would happen if I suspend, right?
right?
How would he be covered if he still enroll under my plan?
Well,
Well-
you won't be able to suspend until you're covered under him.
Okay, so if I.
So you have to wait. So right now you're covered under you, right?
Correct,
And you're
yes.
retiring, but retiring is not a qualifying event for you to be able to change anything. So
I
you
would
guys have
keep
to
it.
stay under yourself until open enrollment. During open enrollment, you guys can move both of you over to his coverage. But the coverage won't start until January 1.
Okay,
So you guys will be under your plan, your retirement plan from August 1st until the end of December. And then you guys will be on his plan starting January 1.
okay. So if I do that, where can I find out what the premiums would be? If it's in Kaiser, and he's also already 65, but he's never, like, he hasn't
He
signed up.
doesn't need to
Okay.
enroll because he's still working.
Okay,
So yourself and an adult, both on Kaiser, it's $450.34 for your retiree coverage for August 1st to December 31st. You'll be paying
Okay.
$450.34 a month.
okay. So there's no split right now for.
No.
No, there's no split. Okay, that was a little bit confusing because when I did ask, they said, oh, but because he's 65, it would be a split plan. So I wasn't really
Mm-mm.
sure about that.
Well, he's still working, so he doesn't need to be enrolled in Kaiser Senior Advantage if he's still working. And if
Okay.
you're under his work coverage, you won't need to apply for Medicare either
Okay,
until he gets ready to retire. You guys will both stay under your Kaiser non-Medicare until you retire, till
Okay.
he retires.
I see. Okay, so I'm going to then assume that it's gonna be 450.34 for from August to December.
Correct.
Until we switch.
Right.
Okay, got it. Thank you
All
so
right.
much.
You're welcome.
Okay, have a
Um,
good day.
You too. Enjoy the rest of your day.
All right, thank
Ronisha,
you.
So David,
have-
Huh?
Oh, sorry. I have a question from Stacy. She said she wasn't able to unmute herself.
Yeah.
Her question is she would like to know more about the UBEN 127 number 3 question.
Okay.
She says, my husband is not on my plan and I'm not on his. Why does it matter if he's employed?
I don't know why it matters. That's a good question. I don't know why it matters. It's on the form. I think because it's asking if you're still employed, you don't need to enroll in Medicare. So I think that's the point of the question. But see, it's so the question, what to enter for question 3, do you or your spouse work? It says, answer yes if enrollee or the UC retiree is employed and eligible for any health insurance benefits elsewhere as an employee. But just because you're eligible and you're employed doesn't mean you actually have it. So I don't see why you wouldn't answer yes. Let me see. Are you covering under his employer plan? I don't know. That's what I want to say no, because I'm the retiree and he's not on my plan. You can say no. I don't know. I don't know how to say, I don't know. I don't know. Honestly, Stacy, I don't know. David,
I am here.
I'm reading your question. You never paid in Social Security. So yeah, you're gonna apply under your own record and get the rejection letter.
Mhm.
And then when she turns 62, you're gonna apply under her record to see if you are eligible that way.
Got it.
Have you
And
been
then-
married? You've been married for at least 10 years?
In 2 months, it'll be 10 years.
Okay, perfect. So that
So-
works.
So, and should I follow the same 3-month in advance kind of window period for both?
I think
events?
for the 62, think you can do the birth month.
All right.
Because you're not applying, for yourself or, before 65. So once you do get that rejection letter, when you enroll or apply,
Mhm.
send that over to the RAS so you can stay in your regular plan until she turns 62 and you apply again. If you still don't qualify, then you submit the same document or the one saying that you still don't qualify, and you'll stay in the same plan.
Now what? Oh, yeah. If she qualifies for Medicare at 65, then I would qualify at 60 when she turns 62. All right,
Yeah.
that makes sense. All right.
Yeah, unless she still needed to work 3 more years to get her 40 credits, but I doubt it.
I'm
By
having a
then, I
moment.
think she should have it.
No, she's happily semi-retired. So
Oh,
when
that's
I
awesome.
retired, so it worked out. All right, thank you.
You're very welcome.
Hi, Monisha. I'm going to
Yeah.
ask a couple of quick questions here. I missed the answer to basically, are UC physicians typically accept Medicare patients?
Yes, that's what I I believe I answered that question. Typically, yes. I would just suggest you asking them if they're accepting new Medicare patients.
Okay,
Or, if you have a current physician, most likely they're gonna accept you unless they opted out of Medicare.
okay. Yeah, I had missed the answer to that originally, but my second question, we went online to enroll in Medicare for my spouse because he turned 65 in June. He did not have an existing account, so we went into to the website just to register him and to elect Medicare benefits.
Mhm.
Some of the questions that they ask you on that website, basically the health related questions or health coverage
Mhm.
related questions. I mean, we have continued coverage through a UC plan,
Yes.
but when I guess answering that series of questions was problematic. It errored us out or made us select something that really wasn't more so a truthful answer.
It was as if you were still working, but you're not.
Yeah, it was a little tough to get through their questionnaire. So I don't know, should we reach out to basically their resources to get through that questionnaire, or are you familiar with kind of how those questions are asked?
If it's on the Medicare website, their questions and their application and stuff, yes, please reach out to them. I
Yeah.
have no idea how their system works. All I know is you've had continuous coverage under UC's active employee plan or group coverage plan, however they word it. So I don't. Was
Okay.
that was the question they asked, or what?
They asked a series of questions that weren't, I mean, it's not the manner of the question, which was a little confusing. So we answered it truthfully. However, it kind of aired us out. So we'll have to go back and revisit that and maybe ask some questions in a different direction.
Yeah.
Okay. Thank you.
You're welcome.
If no one else has any questions, thank you so much, Renisha, for today.
You're welcome.
Everyone has learned a lot. It was very informative.
You're so welcome.
As I mentioned, if you could send me the slides, I will share it with the participants. This video is being recorded, so it will be uploaded to the YouTube playlist. We will include the link with the slides when I share them, so please look out for the email.
I should have turned my camera off so you guys could focus on the so I'm not on the video. I didn't even think about that, but whatever.
No worries. But yeah, thank you so much for your time today.
All right.
And everyone.
Thank you guys. Have a good rest of your day.
Thank you.